Fair Use Act Disclaimer.
Yeah, it's Moana, baby.
Hey there, my fellow Kapiti! It's me, Marie, and I will be your guide for today Moina series, episode 20. If you're ready to further explore and learn the wonders of Moina, then what are you waiting for? Let's start! For today's episode, I used the following as the references: Clinical Anatomy by Snell in the 9th edition and the Kent Hub. I'm going to tackle about the muscles in the thorax, but first I'm going to give you some briefly discussions about it because some of you may have forgotten it due to the countless lesson that you've studied. Thorax or chest is part of our anatomy. It is located between the abdomen inferiorly and the root of the neck superiorly. The thorax protects our vital organs and it provides base for the muscle attachment in the upper extremities. The upper extremities are the shoulder, the arm, the forearm, the wrist, and the hand. Now, let's proceed to the muscles for the anterior part. The first one is the pectoralis major. It's one of the anterior shoulder joint muscles that form the muscular system shoulder girdle. It's a thick fan-shaped muscles at the upper and fore part of our chest. It originates in the clavicle, sternum, and upper 6 costal cartilages. It inserts in the lateral lip of bicipital groove of humerus, and the nerve supply of that is the medial and lateral pectoral nerve from the brachial plexus. Pectoralis major adducts the arms and it rotates it medially. Also, the clavicular fibers flex the arm. The next one is the pectoralis minor. It's one of the anterior muscles of the thorax. It's a thin triangular muscles beneath the pectoralis major at the upper part of the thorax. It originates in the 3rd, 4th, and 5th ribs. It inserts in the coracoid process of the scapula, and the nerve supply of that is the medial pectoral nerve from brachial plexus. Pectoralis minor depresses the point of the shoulder. So, if the scapula is fixed, it elevates the ribs of the origin. So, the next one, we have the subclavius. It's the muscles in the anterior thorax that depresses the shoulder. It's a small triangular that located between the clavicle and the first rib. It originates in the first costal cartilages and it inserts in the clavicle. The nerve supply of that is the nerve to subclavius from the upper trunk of brachial plexus. Subclavius do is it depresses the clavicle and steadies the bone during the movement of the shoulder girdle. The next one is the intercostals. We have 3 kinds of intercostals, which are the external, internal, and the innermost. The first one is the external intercostal. It is the muscle of the thorax that extend from the tubercles of the ribs behind to the cartilages of the ribs in front. It originates in the inferior margin of rib above and it inserts in the superior surface of rib below. External is most active during inspiration by increasing anteroposterior and transverse diameters of the thorax. Also, it supports intercostal space and it moves the ribs superiorly. Now, we have the internal intercostals. It is the muscle of the thorax that extends from the sternum to the vertebral column. It originates in the lateral edge of the costal groove of rib above and it inserts in the superior surface of rib below deep to the attachment of the related external intercostal. The internal is most active during expiration. It supports intercostal space and it moves the ribs inferiorly. So take note that the external intercostal is most active during inspiration and it moves the rib superiorly, while the internal is most active during expiration and it moves the ribs inferiorly. The last one for the intercostals is the innermost. These muscles are very thin that are usually well developed in the lower thoracic wall. It originates in the middle edge of costal groove of rib above and it inserts in the internal aspect of superior surface of rib below. The innermost is acts with the internal intercostal muscles. The nerve supply of the three intercostals are the same, which is the intercostal nerves T1 to T11. The next muscle for the anterior part is the transversus thoracis. It is a plane of muscular and tendinous fibers that is found in the inner surface of the front wall of the chest. It originates in the lower margins and internal surfaces of costal cartilages, second to sixth ribs. It inserts in the inferior aspect of the surface of body sternum, xiphoid process, and costal cartilages rib 4th to 7th. The nerve supply of that is the related intercostal nerve. Transversus thoracis 2 is it depresses the costal cartilages. The next one is the diaphragm. It's a dome shape and it is the most important muscle in respiration. Also, it separates the thoracic and abdominal cavities. It originates in the xiphoid process, lower 6 costal cartilages, and the first 3 lumbar vertebrae. It inserts in the central tendon, and the nerve supply of that is the phrenic nerve. Diaphragm is very important muscle of inspiration because it increases vertical diameter of thorax by pulling central tendon downward. The last muscle for the anterior part is the levator costarum. It's a set of small elevator muscles of the thoracic cage. They pass obliquely downward from 12 vertebrae to the ribs below. It originates in the tip of transverse process of C7 to T11. It inserts in the rib below, and the nerve supply of that is the posterior rami of thoracic spinal nerves. Levator costarum do is it raises the ribs and therefore inspiratory muscles. Now, let's proceed to the muscles in the posterior part. The first one is the trapezius. It's a large, flat, triangular sheet of muscle that extending from the skull and vertebral column medially to the pectoral girdle laterally. It originates in the occipital bone, ligamentum nuchae, spine of 7 cervical vertebra, and spine of all thoracic vertebrae. It inserts in the upper fibers into lateral third of clavicle, middle and lower fibers into acromion and spine of the scapula. The nerve supply of that is the spinal part of accessory nerve motor, C3 and C4 sensory. The trapezius do is that the upper fibers elevates the scapula, middle fibers pull the scapula medially, and the lower fibers pull the border of the scapula downward. The next one is the levator scapulae. It is a narrow, elongated muscle in the posterior portion of the neck. It is deep to the sternocleidomastoid and trapezius muscle. It originates in the transverse process of first 4 cervical vertebrae, and it inserts in the superior medial border of scapula. The nerve supply of that is the C3, C4, and dorsal scapular nerve. Levator scapulae do is it traces the medial border of the scapula. The next one is a rhomboid minor and major. It is lie deep to the trapezius and they are not always distinct from each other. They appear as parallel bands that pass inferiorly and laterally from the vertebrae of the scapula. The rhomboid major originates in the 2nd to 5th thoracic spine. It inserts in the medial border of scapula, and the nerve supply of that is the dorsal scapular nerve. Rhomboid major is the one that traces the medial border of scapula upward and medially, while the rhomboid minor, it originates in the ligamentum nuchae, spine of 7 cervical vertebra, and first thoracic vertebra. It inserts in the medial border of scapula, and the nerve supply of that is the dorsal scapular nerve. Rhomboid minor do is it traces the medial border of scapula upward and medially. And now I'm done. I am sure you pick up a lot of important details in our Moina episode today. To make it greater, I prepared some tips for you. Here are the techniques that you can use in memorizing the Moina. The first one is flashcards. Using a flashcards can really help us because it allows us to repeat the act of learning and memorizing until we become expert on that information. If you're going to study the Moina, flashcards can really help you with that. You can make your own flashcards by using an index card, or you can buy any trusted store that covers the lesson that you're studying. The second one is discover your learning habits. This is very important because it can increase your confidence, competence, and self-esteem. Learning habits vary from student and subject matters. So take note that other people learning strategies may not be applicable to you. So you really need to work on your own learning strategy. There will be a time that your learning strategy, style, or skills may not be relevant anymore. So it means there's something you need to improve and you need to have a new learning attitude. For the last tip, we have the comparison between muscles. It is a must because we all know that some muscles are look exactly the same. So if we didn't study or compare them well, it will be hard for us to identify it. It was amazing to discuss the moina of the thorax with you guys. So always remember that have fun learning. See you next time. Bye!